nearing the end of your life, it is most likely that you will need to seek medical care from a hospital at some point. So it is important that you know your rights as a patient to protect yourself from medical negligence and medical malpractice. We want you as seniors to feel empowered to make decisions about your end-of-life care, even if your wishes might contradict what your family members or doctors might want for you. Because of a concept called patient autonomy, you have the right to make decisions about your own life and your own body in medical settings. It is important to write down your wishes about your medical care in advance so that your family members and medical providers know your desires in case something happens to make you incapacitated and unable to speak your desires for yourself in the moment. The field that aims to protect your patient autonomy and navigate disputes regarding medical care and end-of-life care, as well as resolve any morally gray areas within medicine or research, is called bioethics. Specifically, medical ethics directly relates to your ability to have patient autonomy and have your end-of-life treatment plan go as you would like it to. You might remember the Karen Quinlan case from the 1970s. This case skyrocketed medical ethics into the forefront of the public's mind. If you're not familiar with this case, Karen Quinlan accidentally ingested Valium and alcohol while she was on a crash diet, resulting in her entering into a coma. There was dispute between her doctors and her family members and priest over whether or not to remove her respirator. The case was taken to court. Because she was incapacitated, she was unable to make medical decisions for herself. So the question arose, who was responsible for making medical decisions regarding her medical treatment and medical care? This was the first case of its kind, as respirators were relatively new technology. Because of this, the court case of the Karen Quinlan case set a precedent. This means that hospitals from now on have hospital ethics committees. These are like mini courts within hospitals that handle ethics disputes about patients' medical treatment. Courts ultimately decided in the favor of the family in the Karen Quinlan case, causing some distrust in doctors and in the medical system. What you should take away from this is that you should be setting a medical proxy, so you should have an advance directive that tells your family members and tells your doctors who you want to be in charge of your medical care in case you are incapacitated. You should talk to your medical proxy in advance about your wishes regarding your medical care and your opinions on what role you want end-of-life support to play in your medical treatment. The Karen Quinlan case decision put doctors in more of an advisory role, so ultimately you and your patient autonomy comes first. The decisions that you and your medical proxy make comes first, and the doctors in the moment are there to help aid your decision in a more informed and educated way and help guide you in your treatment plan. The Karen Quinlan case is relevant to you because it established your patient autonomy, which, as you value your independence towards your end of life, is very important to you. Medical experimentation in Nazi Germany also resulted in the Nuremberg Code, which helps to guide ethics within medical experiments that have human participants. Another important case regarding medical ethics is the Tuskegee study. This study makes it important to have informed consent. So for any medical procedures you have, or in case you are involved in any sort of medical experiment, doctors and the people who run the study are required to inform you about the experiment that you are going through and the treatments that you are going through, and they have to get your consent. So again, this puts you in the forefront of your medical decisions and your medical care. It is important to be aware of this field of medical ethics as it directly impacts your end-of-life care. Make sure that you create an advance directive and provide this document to your primary care physician and any other medical professionals involved in your medical treatment. Make sure that you appoint a medical proxy who you trust to carry out your desires for your medical care in case you're in a position where you are unable to advocate for yourself. It is important for you to understand the field of medical ethics as it directly impacts you and your plan for your medical treatment in these next few years of your life.